Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. And I'm here in our office with Faraday, my co-host, and I'm going to let her say a few words and introduce herself again.
Hi, guys. My name is Faraday Golombieski, and I'm a family nurse practitioner here at RevitalyzeMD. And like Dr. Durst said, we're in the office. It's Christmas time. We're all ready for the holidays.
That's right. And so because it's Christmas time, we were going to talk about metabolic syndrome, which is, just metabolic faulty bodies, right? And so We're going to talk about that because we eat unhealthily during the holidays. And so it's a good time to go over this, not to make you feel bad, but to maybe limit it a little bit and then drive those New Year's resolutions as well.
Absolutely. So, we all are making them, right? Whether we say we are or not, in the back of our head, we're all thinking about, we've had Thanksgiving, we've had Christmas, we've had all these parties, maybe indulged a little bit more with alcohol, more so than normal. So what are we going to do to get back into shape, get back into the routine of eating healthy and working out again?
Well, and I think that from this point on, there's sweets at the office every day here.
Yes.
Like whether it's cookies, and our patients are awesome. They bring in cookies, and then the staff are always bringing in sweet things and making them. So it's a lot of unhealthy eating from this point on. So
absolutely
start thinking about the new year. But in the meantime, we're going to talk a little bit about metabolic syndrome. And if you haven't heard that, basically in traditional medicine, and we always talk about how things are addressed, you basically break things down into if you have high blood pressure, or you have high cholesterol, or you're overweight, or diabetes, that there's all these different things, and then they individually treat them with something.
You get a blood pressure medicine, you get a cholesterol medicine,
diabetic medicine. And again, sometimes the doctors are very proactive about talking about nutrition and fitness. And prevention, but not always. And so really what all that falls into is metabolic syndrome. And so if you have faulty metabolism in your body because you're eating bad stuff or you're not exercising.
Or we're overweight. Obesity is a huge one.
Yeah. And this is a syndrome. So it involves all of the above. So
Absolutely.
While we want to say it's diabetes or insulin resistance or, high cholesterol or high triglycerides or obesity, it's all a syndrome.
Exactly.
Caused by bad choices most of the time. Yeah. And behavioral changes are necessary to change it, but you can. You can reverse.
Absolutely. With hard work and dedication.
Yeah.
Absolutely.
Yeah. You can reverse it. So it's something that you need to know about. If you think about as we age, we start to develop a waist and we start to gain weight and we hold weight in our middle, and it's for men and women both. But if you start to see somebody that is gaining weight in the middle.
So we're talking abdominal fat. Big abdominal bellies. That's when you're thinking of metabolic syndrome. There's kind of a picture that goes along with that person. It's somebody with a larger waist circumference that has other risk factors as well. It's not just obesity. So that's really important when we're talking about metabolic syndrome is that, yes, there are these individual chronic diseases and we do need to treat them, but when you gather them together and you meet criteria, then it falls under metabolic syndrome. So with that, you need to have 3 of 5 criteria. So one is waist size. So in men, a waist circumference greater than 40. For women, a waist circumference greater than 35. The other one is that we look at blood pressure. So we're looking at elevated blood pressure. Higher than 130/85 would be another criteria. When we look at your lipid panel, so when we're looking at your cholesterol, another one is a triglyceride of 150 or greater and a low HDL. So that's your good cholesterol. That's the one that we want that number to come up. So for men, it is a HDL less than 40. For women, it's a HDL less than 50. The other criteria for that was blood sugar. So abnormal blood sugar, not just diabetes. So some people may be diabetic, some may be pre-diabetic, but really we're looking
insulin resistant.
Or insulin resistant. So we're looking at those fasting blood sugars of 100 or higher. Hemoglobin A1C, which looks at your blood sugar over 3 months and gives us a percentage. So we're looking at a 5.7 or higher on that. So we're looking just for 3 of those 5 criteria to really classify as metabolic syndrome with obesity being one of the biggest ones.
Yeah. And if you see, again, that person that is, has the abdominal circumference and is gaining weight in the middle, belt underneath the abdomen,
Belly.
Especially with men. And then women, again, it could be a skinny fat, and we'll talk about that a little more, but the abdominal, weight gain and increased waist size is pretty common with women too as they age. And again, this is something that happens with age, hormonal decline. There's lots of things that go into it, but bad choices, not eating healthily and not being active, are things, and those are behavioral choices that we make that are not healthy. And so however we spell it out, there is no magic pill that's going to change this for you. You have to take control and make good choices for that
and
to
it
happen.
was like in looking at studies, it was showing that even like a 5 to 10% reduction in body weight, 5 to 10%, really, that's not that much when you think about it, can bring your blood sugar down. It can bring your blood pressure down. It can help with insulin resistance. So even when we're talking about change, sometimes that road looks really long. Make small goals and hit them. So even 5 to 10% reduction can make a huge difference.
So you got to get on the scale to know that, right?
You got to know your numbers.
So you got to get on the scale. And then again, small goals is, so if you set something like at the end of this week, and the American Diabetic Society will recommend, walking 30 minutes 5 times a week, for instance, which is a great starting point. If you're on the couch and you're feeling resistant to going out, you're feeling lazy, you just ate, that's when you actually just need to get up off the couch and go for a walk. And 30 minutes 5 times a week, everybody has time for. And so there's no way that you don't have time for that. If you're on the couch watching TV or you're on your phone playing, you definitely have time for it. So there's same 24 hours in every day, right?
Exactly.
For everyone, for people that are fit and for people that aren't fit. But this is a health issue, and this is a health crisis in the U.S. because, again, obesity is a big issue. Obesity is a risk factor for COVID severity, and we have not talked enough about that. So, again, those healthy choices and that fitness and just being active and good nutrition choices are not something that we've talked about from a health institute standpoint. At least I have not seen much go out to the public about that. So
exactly. Obesity is such a leading cause in so many of our chronic diseases. And if we were a little bit more active, small goals, 30 minutes. And I'm not talking 30 minutes. We're not talking a leisure walk where you're playing on your phone, talking to your friend. I mean, you need to be walking. You need to get your heart rate up. You shouldn't be able to sing a song, right? If you can sing and not huff and puff while you're walking, you probably need to pick up the pace a little bit.
Although I would say, like, if you're on the couch and you're not making any time to walk, I would take a leisurely walk and sing a little bit, do something, and just get off the couch. So that, or get off the phones.
Get off the phones?
Like we spend so much time on the phone. And so across the board, we need to be doing education for the public on this. And so again, small goals, like at the end of this week, I want to walk, 30 minutes 3 times this week. And you can walk outside. You don't have to have a gym membership for that. And then, setting some goals as far as I'm going to eat healthy, maybe reward yourself if you're used to desserts or whatever it is. Once this week I'm going to, on Sunday, if I've followed everything, potentially have a dessert on Sunday. So just taking responsibility for your choices so that you can prevent stuff. And so this is a reversible condition. And so if you think about fat cells are inflammatory, and all diseases start with inflammation. And so if you have excess fat that you can see,
or visceral fat, so fat around the organs, especially,
and almost across the board, if you have excess fat that you can see and you have an abdominal circumference that's bigger than it was, or arms or legs, if you have that, you have visceral fat.
Yeah,
for sure. There's some people that don't have much on the outside that you can see, but they still have visceral fat, and that's fat that basically wraps around your organs, and so they don't function like they should, like liver and pancreas, and therefore you have, again, insulin resistance and all that. So, but knowing this, so again, going to the doctor and getting a high blood pressure and then a pill, or a high cholesterol and then a pill, you're diabetic, let's put you on metformin. If they put you on a medicine but don't discuss choices and behavioral changes that can change that, then that's a disservice to you because this is something that you can reverse.
Absolutely. And then you're just adding on to it. So if you go to the doctor and you have high blood pressure and they put you on a blood pressure medication, but you don't make any changes in your life, next time you go to the doctor in a year, your cholesterol might be up. There's another pill. And we're just adding on to it. So you're just adding on to these disease processes by not changing or trying to fix root cause, by being more active, trying to eat more healthy. Definitely keeping track of your food daily on a food journal. People tell me all the time, I eat clean. Write down what you ate for the week and look at it and really be honest with yourself. A lot of us don't eat as clean as we think. I'm guilty of that. Sometimes I'll say, oh, I've done so good, but then I'll go, ooh, well, I did have this or I did have that. I forgot about that.
No, we hear a lot of, the eating healthy and, no added salt. But if you're doing processed foods or you're doing fast food, you have all of the above, like you're eating unhealthily, even if it's a chicken sandwich from somewhere, in that salt and processed food. So there's studies, that 1 out of 7 Americans have metabolic disorders.
Yes.
So metabolic syndrome, or metabolic dysfunction, 1 out of 7 Americans. And if you think about it, then that's for people that are overweight. But if you look at people that actually have a normal BMI, somewhere between 18 and 25, you're still talking about 30 or 40% of them that are skinny fat with metabolic disorder as well. And so that's a huge percentage of people in the U.S. And we don't think that costs a lot of money. So again, pharmaceutical companies make a lot of money off the drugs that they're giving you, and you're paying a copay for that. Mm-hmm. There are people that can save tens of thousands of dollars a year in copays for their medications. And again, pharmaceutical companies are going to make money. So who's going to educate? Because if you follow the money, again, they have more control over public education, or lack thereof. They're not going to promote a healthy diet and fitness.
No, they're promoting their medication on the commercials. Ask your doctor about whatever it may be. Fill in the blank with any medication that you see on a commercial.
Yeah. And, there's definitely some needs for medications and definitely until you get healthy, but these are reversible conditions. So behavioral changes, personal choice, and you can reverse these conditions. So you can get your blood pressure down, you can get your lipid panels better,
and then come off those medications.
Your insulin resistance. So again, a lot of times what they'll do is insulin resistance and diabetes is a spectrum too. So it's anywhere from I'm normal and I have normal blood sugars and A1Cs all the way to I have diabetes. And in between is an insulin resistance and a pre-diabetic. And we follow that with hemoglobin A1Cs. And so sometimes you'll get labs and they'll say, we're looking at a 3-month blood sugar. That's the hemoglobin A1C.
Or even liver labs, looking at liver enzymes, looking at your ALT and AST. If you look at your annual physical, those labs are always going to be on there. Mm-hmm. So sometimes when we are having some insulin resistance, we can see it in there. The non-alcoholic fatty liver disease, you see that with those elevated levels. And that is where it's just not getting into the muscle like it should. It's bypassing and the liver's having to deal with it and overflowing, and then we're seeing that breakdown in the tissue show up on labs.
And fatty liver with, again, elevation of your liver function test, that means there's fat around the liver and they're not functioning and you need to get that fat off. And so again, that is present sometimes when it's not visible on the outside, but always when it's visible on the outside. So again, things we can do. And again, as we age, we have some hormonal decline, and obviously, these are personal choices that we can make to make ourselves healthier. Yeah. And then there's also other steps you can do to prevent. And, if hormones are off, that's potentially something. But this is something you don't have to go to the doctor to do. This is something you can do at home, take control, and go be active and eat healthily and control, having to be on medications.
Exactly. And this is not, like Dr. said, this is not just aiming at those that are obese. So there is, JAMA put out a study in 2019 because you brought up a normal BMI, but a larger waist. And they have an open study running of 155,000 postmenopausal women. And what they found out of that study was that with a normal weight, a waist circumference greater than 35, those women were 1/3 more likely to die of cancer or heart disease than those women that had a normal weight and a smaller waist circumference. So think about that. 1/3 more likely to die of cancer or heart disease with a normal weight, but an elevated waist circumference. That's huge. What does that tell you? This is not, we joke around, she, said skinny fat, but that's what we're talking about. This affects everybody. So visceral fat you can't see. So it is, it reaches more people. That's why, 1 in 7, or let's say over the age of, median age of 52, over 50, to 1 in 3 Americans have metabolic syndrome or fit that criteria.
And if you think about it, if you have fat present, that you can see. So like your thighs or on top of your knees. And these are things that women will experience as they age. Again, bra fat, back
love
of the
handles.
arms, love handles, and that I'm gaining weight. I'm doing all the same things that I used to do. So again, if your personal choices are good, then you want to potentially look at hormone optimization and other stuff. But if your personal choices need to be cleaned up, then do that first or do that in conjunction with, talking to your primary doctor or seeking a hormone specialist to optimize those because it'll help. But if you have fat cells present that weren't there before, that's a body composition change or, a change in your metabolism, and fat cells are inflammatory, which cause diseases. So when Faraday's talking about diabetic or cancer or heart disease or brain diseases and Alzheimer's and stroke and so you're increasing your risk for all of the above. So increased stroke, increased risk of heart attack, and
kidney disease. That's another one that goes with it.
Yeah, absolutely. You have all of that, and then diabetes too, and diabetes puts you at risk for everything else. So if everyone's so concerned right now, I will stress this point, if we're so concerned right now about getting sick with a virus that now has been 2 years present, right? So it's a virus, we've had viruses and exposure forever. So if you're ultimately so concerned with what other people are doing or whether you had the vaccination yourself, I think you need to also be doing the other things that can support your immune system, which is being active and eating healthily. And those are personal choices, and there are no excuses in life, and there's no medication that can make your choices better, right? So I would say that if you're going as far as ever taking a medication or injecting something into your body, you need to be doing the things that you personally are responsible for. That's your part. So, and I think that we don't talk enough about that.
We don't, especially when you look at hospitalization rates, and we're looking at obesity being so prevalent in those that are hospitalized and not getting better or dying. Disease, virus, any of the above, take your pick. It's a huge driver of it. It's a huge factor that we don't talk enough about. So I agree. We need to take responsibility for ourselves, be healthier overall, and not hope that a pill or an injection is going to do it for us.
Yeah. Well, and I would go as far as like always in life, just rules of nature, right? We're only we can only be responsible for ourselves. Yes. And so if you're doing everything you can do, then you feel pretty confident that if you happen to get an infection or you're in a car accident. I mean, again, there's a risk of living life every day, right?
Exactly.
You walk across the street and you get hit by a car. You're driving your car. There's a risk. Viruses are out there. That's a risk. But if you're doing everything you can do to keep yourself healthy, you're going to feel a lot better about recovering from anything that you get.
Absolutely. And you're going to be in the best state to be able to recover, which is really important.
Yeah, and not being angry and not being stressed and all that stuff. stuff is all good for your immune support. So I think, again, on metabolic syndrome, just being active, making good choices, eating healthily. And as Christmas time comes around, we obviously know that we're going to eat a little more, I guess, unhealthy, and we're going to drink a little bit more. We're going to lose our usual discipline. So for that reason, I think that we need to at least beware of that, or be aware of that, and then also maybe just be a little more active. And again, it might be cold, but going outside is a good thing. Fresh air and walking doesn't cost you money. If you have a gym, do that, or just exercise and stretch in the house.
Absolutely. Yeah. Run in place.
Yeah, run in place. Because if you're eating a little bit out of the ordinary, then I think just be a little more active or aware of that. And then those New Year's resolutions too, right?
Absolutely.
So just kind of set that, like, okay, this month might not be the best month for me, but in January, I'm going to start something. And again, like Faraday said, start the goals,
goals
on
are
a
so
weekly
important.
basis, small goals, weekly goals, because then if you do that and you become disciplined, then you won't, putter out by like March, right?
Most people, I think the statistics said by like the end of January, most people have already failed their New Year's resolution goals.
I don't like to go to the gym in January.
Be realistic.
All of a sudden it's very busy.
Yeah.
Right?
Small goals, be realistic. You got this.
Yeah, you got this for sure. So if you have any comments, and again, we're going to talk a little bit more about this and even resolutions and,
and how it affects men with ED and other things.
And how it affects function, otherwise sexual function for both men and women. So, and body image for women, and probably more erectile stuff for men. So if you have any comments, anything you want to share, anything you might have been told by a healthcare professional that you have questions about, please let us know. If there's anything else that you would like us to cover in a podcast, we're willing to do all things aesthetics and wellness. So just let us know. And again, hit the bell, subscribe, like, share with friends. And again, we're here to revitalize your look, your health, and your sex life. Thank you.